To this devastating story now, a study by the University of Cape Town and Oxford University has revealed that South Africa has the highest number of COVID-19 orphans on the continent. Just over 20 countries were surveyed, including Argentina, Brazil, Spain, Zimbabwe and the United States. Between March of 2020 and April of this year, 94,625 children under 18 have lost parents and caregivers to the pandemic. Let's unpack what this means for us. Professor Lorraine Sherr is from the University College of London, is also the co-author of this report, and she joins us now with some analysis on the findings. Professor Sherr, it's great to have you with us this morning on the AM report. I mean, where do we even begin to unpack this staggering number of COVID-19 orphans? Almost 100,000 children under the age of 18 losing a primary caregiver.
Yes, the numbers are high, and the global figures we estimated are well over 1.5 million. And we need to wake up. We need to be putting children at the center of the COVID response. We are so focused on vaccine and perhaps the elderly and oxygen, and we're forgetting that this is a hidden component of the pandemic that needs urgent attention.
I see that part of the outcomes, or some of the analysis around the outcomes of the study, has also equated it to the HIV/AIDS, Ebola and influenza epidemics, insofar as you know, the same around the same theme, the amount of children that were left without a primary caregiver during those epidemics. What can we learn, if anything, whether it's about the lack of response then to how we can do better now?
Yes, we have some good evidence. You know, in earlier pandemics, when people didn't know what to do, they couldn't turn to the evidence. But now we do. So, for example, we know that some very straightforward, high-level interventions, like ensuring support and immediate cash and family care for these children, would be in their best interest, and we should learn from that. We also learned from the pandemic that despite the fact that in many countries orphanages had closed down, in some countries they mushroomed, and we know categorically that there are many negative impacts of large institutional orphanage care of children. So we need to avoid going down that path, and our knee-jerk reaction has to be hold on, put families first, and get very rapid support to these children. We also know, sadly, in Africa, where families have lost perhaps a parent to HIV, they may have been cared for by the grandparents, and it may be this grandparent who is now succumbing to COVID. So we have to be aware that some of these children will have multiple burdens.
Sure. Yeah, I'm actually looking at that exact line. 23% of the children in these 21 countries that were surveyed were being taken care of as a start by a single primary caregiver. I mean, you know, how do you begin to understand the impact of losing that primary caregiver and how a child is then meant to cope mentally, but also into the future?
Yeah, and you know, we know that once this loss is experienced, it really is a permanent loss. So the children have this huge challenge, and it's a lifelong challenge, and we really have to rally. We also know that children are quite resilient, and many children can actually step up to the plate and really do well if they're given good resources. But we also know that if you throw a lot of problems at children, one after the other, they accumulate. And children who face multiple accumulated shocks and stresses suddenly start to experience a kind of toxic shock.
Sure.
And we have to prevent this.
So you know, you talked about sort of the immediate responses in terms of how we can support children who do experience the loss of a caregiver and a primary caregiver. Among them is the issue of ensuring financial support and family care. In terms of South Africa's own response, how do we score?
Well, the numbers are very high in South Africa. When we looked at our global data, we tried to look country by country, and we actually have a calculator which is linked to live data that shows South Africa high. This is probably a function both of the nature of the pandemic in South Africa and also the underlying family size, so that if a mother with several children dies, more children are impacted. So South Africa is facing a huge problem in this area, and one that I'm not quite sure how they will rally. For a start, do governments immediately have policies in place? Do they have funding streams and support in place? We find very little evidence of this. We also think that this might be an underestimation because, people who die at home, people whose deaths are unregistered, people who live in a country where perhaps the death certification and the COVID counting is not perfect, might come up with an underreport. So we think that our figures may well be an underestimation.
I mean, and that's incredibly alarming, isn't it? The number is already so incredibly high. If you were to, I don't know whether your analysis does go this far, but if you were to give us a number as to, how close might the real number be, what might it be? Do you have an answer on that score?
We don't have an answer, but I think the answer we do have in terms of our current numbers is scary.
Yeah.
So what we can say with confidence is the number will be larger.
Yeah.
So how much more evidence do policymakers and government need? We really think that we say there we have talking about COVAX delivering vaccines, but what about CareVax? We think vaccines should be available very much more rapidly to protect people from future deaths, and we also believe that care for these children should be central to government policy, and they should be thinking and planning right now.
Yeah, absolutely. We're so incredibly focused on the medical response to the pandemic, but are we focused enough on the kind of impact that will be left behind by these shocking numbers? Almost 100,000 children under the age of 18 losing a primary caregiver to the pandemic. Professor Lorraine Sherr, thanks very much for your time on this incredibly worrying story. How much of this information is trickling into government policy remains to be seen. She's with University College London and is a clinical psychologist.